for having me speak today. As you heard, our founder was unable to join us today. He's in South Florida, but sends his greetings and his disappointment about being able to be here in person. And I hope you join me in thinking good thoughts for the millions of people who already have been affected by this storm and who will be in the coming days. That said, I've also been thinking just about the connection between real estate and this hurricane that is passing over the Caribbean and is going to be moving into Florida, and thinking about how it's lucky in some ways that this is happening today as opposed to several decades ago. And it really is a testament to modern architecture, technology, building design, that there are buildings now in South Florida that have been built to withstand the power of storms like this. And that innovation is going to help keep millions of people safe over the coming days. But I'm here today to talk about another challenge that real estate can help us tackle, and one that affects us globally. And that's about real estate that doesn't just help keep us safe, and that isn't just beautiful, but real estate that actually helps make us healthier. You may be thinking, besides healthcare facilities, which we just heard about, what does real estate have to do with health? And it turns out that it actually has a lot to do with it. What medical professionals have found is that actually the single biggest determinant of our health is not our genetics, it's not our access to medical care, but it's actually the physical and social environments that we live in and that we spend time in. And where are we spending most of our time? Well, 90% on average of our time is spent indoors in buildings. That's probably higher here in Dubai and across the Middle East, particularly in your warmer months. And so the homes that we live in, the offices we spend time in, the schools our children attend, they impact our health in profound ways. How active we are, how we sleep at night, how inspired we feel, how much we interact with the people who are around us. And so I'd ask you to think about, to crystallize that a bit, a typical day for you or one of your colleagues. You may leave your home, drive to work, get to the lobby of your building, take the elevator to your office, sit at a desk most of the day staring at a screen. Maybe you take a break for lunch or have a snack, grab whatever is most convenient. It may not be the healthiest option. And all the while you're surrounded by furniture, building materials that you probably don't know that much about in terms of what chemicals are included in those, chemicals that can off-gas into our air. And that's in part why we're facing some of the crises in health and some of the issues that we are today. Rising rates of obesity here in the UAE, across the Middle East, and globally that are contributing to a host of chronic diseases like heart disease, strokes, cancer, diabetes. These are diseases that hurt us, they're enormously expensive to treat, and they are largely preventable. We've been sitting for about 2 hours now, so I would ask everyone just to, in light of that, just get up for a minute and just take a minute or two to just stretch a little bit. And I'll tell you that these kinds of micro breaks throughout the day are really critical for our metabolism and for our health. If you think about it, we live in very unnatural ways today. Our bodies evolved for hundreds of thousands of years to be outside, in the sun, surrounded by nature, walking, being active, interacting with people throughout the day, eating healthy and simple food. And so today, the environments that we find ourselves in are basically the opposite of how our bodies evolved to be healthy and successful. And so doctors are trying to treat us once we've developed these kinds of conditions, once we've developed these kinds of diseases. But instead, we should also be looking at, feel free to sit down if you want, we should also be looking at the conditions that helped lead to these kinds of health conditions, the real estate and the built environments that we create. And we should be looking to create real estate that helps support our health instead of harms it. We should be looking at creating places that make it easy for people to lead healthy lives. And that's why the WELL Building Standard was created. It's the world's first building standard that's focused specifically on improving the health and well-being of the people who spend time in those buildings. It was developed in collaboration with leading medical professionals, physicians, and industry professionals from institutions like the Cleveland Clinic and the Columbia School of Health, using evidence-based research about how to create environments that optimize people's well-being. This is about using data and evidence to inform what wellness really means. We're building on that research with a Well Living Lab, which is a partnership between IWBI's parent company and the Mayo Clinic, where we're further researching how the indoor environment impacts people's health in a sensor-rich modular environment where we can simulate conditions of a house, an office, a hotel room, and vary the environmental parameters in that space to examine the impacts. And the Well Community Standard, which was just launched by our organization this week, is a companion to the Well Building Standard, focusing on how design at the neighborhood level can support people's health as well. These Well standards include evidence-based protocols in 7 key areas that impact our health and wellness: air, water, nourishment, light, fitness, comfort, and mind, with strategies in those areas for health-based design, construction, and operation of spaces. And Well isn't just about designing for health, it's also about making sure that spaces are performing for health. So Well includes performance tests of a space's air quality, water quality, lighting, and acoustics. Have you ever been in a building where you know what is in the air that you're breathing? Most of us haven't. And there are studies showing that, for example, in some schools in UAE, there are levels of VOCs that are twice the recommended limit. And that's no surprise. That's probably common in many of the buildings throughout the world, because VOCs are in everything from our furniture to paint to carpets. But we also know that there are safer alternatives that we can be using and considering. And there's incredible research now coming out from entities like the Harvard School of Public Health that are showing that when you have cleaner air indoors, fresher air for people to breathe, that it actually can double people's impact on cognitive tests. And so if you think about that for a minute, about how by improving our building technology and our design, we actually have the ability to improve people's productivity, to help our children in our schools, how can we not rise to the challenge of doing so? This is about the next wave of sustainability. Dubai and the UAE have always been innovators. We've heard about much of that already today, especially through real estate. Your initiatives for green buildings, smart buildings, they inspire the world. Your Dubai plan puts people at its center, and your happiness initiative aims to create a more engaged and positive population. Now it's time for this new field of innovation in real estate that can help us achieve those goals, buildings and communities designed to optimize people's well-being, their health, and their performance. Since Well was launched in late 2014, its adoption has spread throughout the globe. There are now more than 500 Well registered or certified projects in 31 countries throughout the world. And here in UAE, there are 9 registered Well projects, which includes the headquarters of Dubai Holding, Alpen Limited, Xworks, and Zuleka Hospital in Sharjah. Well certified spaces are designed to engage people, inspire people, and to show occupants that a company or a developer values them, their health, and their well-being. This isn't about design being more costly. It's about using health research and science to make smarter design decisions. It's about things like choosing different light bulbs, potentially, ones that more closely mimic the spectral distribution of the sun to help align people's circadian rhythms and to boost people's energy levels. Any company knows that their biggest value is in their people. One of my favorite quotes is by Winston Churchill. He said, "We shape buildings, and thereafter they shape us." So let's use real estate to help shape better people and a better world. Thank you.
We've got time for a couple of questions, Kate. And Your last slide, or your penultimate slide, I think was the kicker, because a lot of developers here, a lot of consultants will be thinking, as they do with LEED certified buildings, that's great, but what's it going to cost me? Because whether we like it or not, that is important. What can you tell us about the economics of well buildings and implementing some of these things?
Sure. So, like I said, this doesn't have to be about spending more money. It really is about thinking about health and wellness really from the onset of a project. And so it's often about making substitutions in terms of the products that are being used. What we're seeing from some of the initial projects, I showed one example actually from Structure Tone. I won't get back to that, but that are finding that the premium on their hard costs for integrating well can range anywhere from nearly 0% to about 3 to 4% of their construction costs. So again, it really is about making different decisions, not necessarily more costly ones.
We'll take one question if we can, one quick question for Kate on this before we have to move on. Or do you want to save it? Yes, please. Thank you, sir. I'll take a very quick question. Microphone's behind you.
Thank you. I'm Jun Palo Fox. I started working in Dubai as a town planner in 1977. But for question, planning healthy cities, we must, by design, encourage people to walk 10,000 steps a day. That's 7 kilometers. In Dubai, it's not that walkable. Any comments on that? Walkable cities, you must walk at least 10,000 steps. It can address your obesity and your diabetes.
Yeah. So that's a great question. I think the question was about how can Dubai and other places encourage more physical activity and walkability, and there's many ways to do that. One is obviously through creating communities that are more connected and more walkable. But the other way is in thinking about how can we integrate small bouts of physical activity throughout our day, and that can be through simple things like designing staircases that are accessible and attractive for people to use, incorporating sit-stand desks into people's workspaces, designing offices that encourage people to walk throughout them in terms of how you're strategically locating your services and amenities. What doctors are finding is that we don't necessarily need to go to a gym and work out half an hour or 40 minutes every day to be healthy, but we do need to integrate physical activity into our daily lives. And things like taking those breaks throughout the day is also something that doctors have found is really critical to counteracting some of the harmful impacts of sitting that doctors are finding now that's affecting people.
Kate, fascinating stuff. Thanks very much indeed. Appreciate you joining us today, particularly at the last minute.